you so much, Mr. Speaker. Franklin B. Roosevelt, the 32nd President of the United States of America, in his address at the University of Pennsylvania on November 20, 1940, said this: "We cannot always build the future for our youth, but we can build our youth for the future." Mr. Speaker, ladies and gentlemen, mahal kong mga kababayan, I address this August Chamber to discuss the pressing issue of mental health problems besetting the Filipino youth today. FDR words almost 81 years back still ring true this day. We can and we must build our youth for the future. But how exactly are we going to do that? Article 2, Section 13 of the 1987 Philippine Constitution provides that the state recognizes the vital role of the youth in the nation building and shall promote and protect their physical, moral, spiritual, intellectual, and social well-being. While the fundamental law did not specifically include mental among the well-being of the youth that must be promoted and protected by the state, many of us here have affirmed as a matter of policy during the 17th Congress of the Philippines the basic right of all Filipinos to mental health as well as the fundamental rights of people who require mental health services. Almost 3 years after Republic Act No. 11036, otherwise known as the Mental Health Act, was enacted into law on June 20, 2018. Its various provisions that mandate the formulation, development, and implementation of the national policies, strategies, and programs and regulations relating to mental health, integration of mental health care in the basic health services, as well as those strategies promoting mental health in educational institutions, the workplace, and in communities, among others, are now being put in a rigid test against the raging spread of the deadly COVID-19 pandemic in the country. The issues and concerns regarding mental health are varied and specialized. I have, however, reasoned today with one particular reason in mind, and that is to build our youth for the future. That awesome task, however, stands wobbly in the face of the fact that the number of suicide cases and students with mental illnesses had risen drastically in the past years, with at least one suicide referral made each day. According to the 2015 World Health Organization Global School-Based Student Health Survey, among 8,761 students from grades 7 to 9 and 40 in the Philippines, 11.6 among the 13 to 17-year-olds considered suicide, and 16.8% among 13 to 17 years old attempted suicide. That was before the advent of the present public health crisis. Recently, a study entitled "Psychological Impact of COVID-19 Pandemic in the Philippines" has examined the prevalence of psychiatric symptoms and identified the factors contributing to psychological impact in the Philippines, and it found out that out of total of 1,879 completed online surveys that were gathered from March 28 to April 12, 2020, female gender, youth age, single status, students, specific symptoms, recent imposed quarantine, prolonged homestay, and reports of poor health status, unnecessary worry, concerns for family members, and discrimination were significantly associated with greater psychological impact of the pandemic and higher levels of stress, anxiety, and depression. It was also reported that data from the National Center for Mental Health's hotline saw an alarming spike of calls in the midst of COVID-19 pandemic, including a monthly average of 53 suicide-related concerns, where a high volume of calls were observed in the month of April, May, June, and July. It also reveals that from an average of 13 to 15 daily calls before the pandemic, mental health providers are now receiving around 32 to 37 calls per day. From around 300 to 400 calls in May 2019 to February 2020, it spiked to at least 1,000 calls from April to July 2020. Majority of the calls are due to anxiety-related concerns. Suicide-related calls likewise peaked in July 2020 with 115 calls. Obviously, Mr. Speaker, the current public health crisis is already taking its toll not only on the health of our people as a whole, but on the mental health of the Filipino youth in particular. Mental health or issues of mental health in the context of COVID-19 pandemic risks more intensely today, this very moment as we speak, as everyone is generally confined at home, especially our youth. Because of this, it bears asking, what now Department of Health? What now Commission on Higher Education? What now Department of Education? What now TESDA? What now Department of Interior and Local Government? Where are you in these most difficult times? Starting from Section 15, the Mental Health Act provides for different levels of quality mental health services, which start in the community. The law provides that responsive primary mental health services shall be developed and integrated as part of the basic health services at the appropriate level of care, particularly at the city, municipal, and barangay level. The standards of mental health services shall be determined by the DOH in consultation with the stakeholders based on current evidences. Every local government unit and academic institution shall create their own program in accordance with the general guidelines set by the Philippine Council for Mental Health, created under this Act in coordination with other stakeholders, LGUs, and academic institutions shall coordinate with all concerned government agencies and private sector for the implementation of the program. Section 21 on suicide prevention mandates that mental health services shall also include mechanisms for suicide intervention, prevention, and response strategies with particular attention to the concerns of the youth. 24/7 hotlines to provide assistance to individuals with mental health conditions, especially individuals at risk of committing suicide, shall be set up, and existing hotlines shall be strengthened. Then Section 23 of the law provides that the state shall ensure the integration of mental health into the educational system as follows. Age-appropriate content pertaining to mental health shall be integrated into the curriculum at all educational levels, and psychiatry and neurology shall be required subjects in all medical and allied health courses, including postgraduate courses in health. The last provision of Republic Act 11036 that I will mention, Section 24, is particularly critical. Educational institutions such as schools, colleges, universities, and technical schools shall develop policies and programs for students, educators, and other employees designed to raise awareness on mental health issues, identify and provide support and services for individuals at risk, and facility access, including referral mechanisms of individuals with mental health conditions to treatment and psychosocial support. All public and private educational institutions shall be required to have a complement mental health professionals. As I have earlier queried Mr. Speaker, what now? What has been done? Where are we now in the implementation of the Mental Health Act, particularly when it comes to the provision of mental health services to our young people? These questions, and more importantly, the answers to them, become urgently critical in the context of the fact that adequate health information, having grown-up children, perception of good health status, and confidence in doctors' abilities were significantly associated with lesser psychological impact of the pandemic and lower levels of stress, anxiety, and depression. So again, let me ask, where are the mental health services for the youth? Especially because the law mandates that all public and private educational institutions shall be required to have a complement of mental health professionals. I do not certainly see that happening now. Unfortunately, the existing Department of Education's guidance and counseling program is being undermined by the scarcity of guidance counselors, primarily because of salary issues. Primary importance given to academic or curricular development in the face of the country's urgent need to improve the quality of education also impairs the proper attention that should be given to the mental health of the Filipino youth. Given the many problems brought about by the negative effects of the emerging technologies on children, alarming suicide rates among youth, and the need to adequately prepare our students in choosing their career tracks for the K-12 program, not to mention the COVID-19 pandemic, it is important to strengthen the current guidance and counseling program of the Department of Education through a functional and structural restructuring of guidance and counseling organization in schools throughout the country. Proper attention to mental health services cannot be sacrificed in favor of academic development, inasmuch as the intellectual development of our youth can only prosper if they are given the adequate mental health services they so badly need, especially with the challenges of rapid technological modernization around the globe that is already taking its toll in the emotional well-being of the many people, especially the youth. Technology such as cell phones, video games, internets, and computers have become an integral part of nearly every teenager's life, especially because of the forced distance, blended, and modular learning modes, such that it becomes imperative to guide school children regarding the responsible use of technology for them to make the most of its effect on their lives. Despite the immense need for counseling professionals, we have a very limited number of school-based counselors, psychologists, and social workers who are serving in our educational institutions, which is unfortunate considering that schools are supposed to be essential partners in caring for students' mental health. In the face of all this, Mr. Speaker, dear colleagues, we need to remember that mental health is an integral part of the Sustainable Development Goals, specifically Goal number 3, which focuses on ensuring healthy lives and promoting well-being for all at all ages, especially on the part of the youth. That is, if we still stand by results, the youth is the hope of our future. Mr. Speaker, it is therefore imperative to scale up the implementation of the specific provisions of mental health law that will directly impact our young people. I ask the LGUs to fast-track the provision of a responsive primary mental health services at their communities, which shall be developed and integrated as part of the basic health services at the appropriate level of care. These services should include mechanisms for suicide intervention, prevention, and response strategies, with particular attention to the concerns of the youth. I appeal to the DepEd, along with the local government units, to immediately craft responsive mental health programs. I urge the Department of Health to fund the establishment and assist in the operation of the community-based mental health care facilities in the provinces, cities, and cluster of municipalities in the entire country based on the needs of the population. I call on the Department of Health and the local government units to initiate and sustain a heightened nationwide multimedia campaign to raise the level of public awareness on the protection and promotion of mental health and rights, including but not limited to mental health and nutrition, stress handling, guidance and counseling, and other elements of mental health. I ask CHED, DepEd, and TESDA to ensure the immediate integration of mental health into their respective educational systems. At sa ating mga kabataan, nananawagan ako na maging malakas at matatag kayo sa lahat ng mga hamon at pagsubok. Kayo ang pag-asa ng bayan at sa inyo nakasalalay ang paggising at pagbangon ng bansang ito. Lastly, Mr. Speaker, let me plead on the members of this chamber to perform the oversight necessary to ensure that relevant agencies of the government are doing their part in the realization of quality and sustainable mental health services to our youth. This we must do if we are to build our youth not only for today, but for the future. Thank you, Mr. Speaker. Thank you, everyone, and good afternoon.
Majority Leader. Mr. Speaker, our colleague Representative Sarah Jane Elago wishes to make a manifestation in relation to the
ng pagpapalakas ng mga serbisyo at mga hakbang tungo sa pagsasakatupak ng mga layunin ng National Mental Health Law sa ating bansa. Napakaganda po ng mga layunin na napagtagumpayan ng Kongresong ito pagdating sa pagbibigay ng angkop na atensyon sa kalusugang pangkaisipan, kasabay ng kalusugang pisikal at pandamdamin, higit lalo na dun po sa mga bagay na hindi natin nakikita, lubos na kinakailangan ng mga accessible na mga services para sa mga kabataan. COVID-19 has affected the lives of students and all education stakeholders and everyone else. For students, the pandemic has impacted both their studies as well as their participation in society. Due to school closures, students have been unable to come together in physical spaces, massively affecting their community and organizational work, as well as their relationship and communication with their teachers, faculty members, and other members of the communities. Kasama din po dyan yung ating constituency work. Talagang tayo ay natulak mag-explore ng mga bagong mga pamamaraan, principally via digital and online means, ngunit hindi po yan sapat. Higit na kinakailangan ng malaman ng mga kabataan at mga estudyante na kasali sila doon sa lahat ng aspeto ng pandemic response and recovery, lalong-lalo na sa sektor ng edukasyon. Akin pong hinihingi rin ang suporta ng ating Chairperson ng Committee on Health sa panawagan ng kabataan na magkaroon na ng malinaw na gabay hinggil sa ligtas na muling pagbubukas ng mga paaralan simula dun sa mga areas na walang kaso ng COVID-19 at may pinakamababang transmission rate. So pwede po nating paghalawan ang karanasan ng iba't ibang mga bansa hinggil dito para pagsuporta na rin doon sa established na ng mga benefits ng face-to-face classes. Napakahalaga po para matulungan